81. Colorectal cancer is often asymptomatic in its early stages. True or false? Answer: true. Rationale: early-stage colorectal cancer often lacks symptoms, underscoring the importance of screening, e.g., colonoscopy, to detect polyps or tumors before symptoms like bleeding or obstruction occur. 82. Radiation therapy is used to treat all types of leukemia. True or false? Answer: false. Rationale: radiation therapy is rarely used for leukemia, which is primarily treated with chemotherapy and stem cell transplantation. Radiation may be used for specific complications, like CNS involvement. 83. Anemia is a common complication of chemotherapy. True or false? Answer: true. Rationale: chemotherapy suppresses bone marrow, reducing red blood cell production and causing anemia, which leads to fatigue and may require erythropoietin or transfusions. 84. All melanomas are caused by sun exposure. True or false? Answer: false. Rationale: while most melanomas are linked to UV exposure, some arise from genetic mutations, e.g., BRAF, or occur in non-sun exposed areas, e.g., mucosal melanoma, indicating other contributing factors. 85. Patient education in oncology includes teaching about self-care for radiation skin changes. True or false? Answer: true. Rationale: patients receiving radiation therapy are taught to use gentle soaps, avoid sun exposure, and apply recommended creams to manage skin changes like erythema or desquamation. 86. Brain tumors are always malignant. True or false? Answer: false. Rationale: brain tumors can be benign, e.g., meningiomas, or malignant, e.g., glioblastomas. Even benign tumors can cause significant symptoms due to their location and pressure on brain tissue. 87. Targeted therapies have fewer side effects than chemotherapy. True or false? Answer: true. Rationale: targeted therapies attack specific cancer cell pathways, causing fewer systemic side effects than chemotherapy, which affects all rapidly dividing cells, though they can still cause unique toxicities. 88. Psychosocial support is only needed during active cancer treatment. True or false? Answer: false. Rationale: psychosocial support is needed throughout the cancer journey, including diagnosis, treatment, survivorship, and end-of-life care, to address emotional, social, and spiritual needs. 89. Chronic lymphocytic leukemia is more common in older adults. True or false? Answer: true. Rationale: chronic lymphocytic leukemia, CLL, primarily affects older adults with a median diagnosis age of 70 and is rare in younger individuals, often presenting with lymphadenopathy or fatigue. 90. Sunscreen is ineffective in preventing basal cell carcinoma. True or false? Answer: false. Rationale: sunscreen reduces UV exposure, a major risk factor for basal cell carcinoma, the most common skin cancer, by protecting skin from DNA damage. 91. Superior vena cava syndrome is always caused by cancer. True or false? Answer: false. Rationale: while often caused by cancers like lung cancer or lymphoma, superior vena cava syndrome can also result from non-malignant causes like thrombosis or benign tumors, though cancer is the most common etiology. 92. Chemotherapy can cause cardiotoxicity as a long-term side effect. True or false? Answer: true. Rationale: certain chemotherapy drugs, e.g., anthracyclines like doxorubicin, can cause cardiotoxicity, including cardiomyopathy or heart failure, requiring baseline cardiac evaluation and monitoring. 93. Cervical cancer is always symptomatic in its early stages. True or false? Answer: false. Rationale: early-stage cervical cancer is often asymptomatic, highlighting the importance of regular Pap smears or HPV testing to detect precancerous changes or early disease. 94. Fatigue in cancer patients can be managed with exercise. True or false? Answer: true. Rationale: moderate exercise, tailored to the patient's condition, can reduce cancer-related fatigue by improving energy levels, muscle strength, and psychological well-being. 95. Hormonal therapy is used to treat all types of breast cancer. True or false? Answer: false. Rationale: hormonal therapy, e.g., tamoxifen, is effective for hormone receptor-positive breast cancers, ER/PR positive, but not for triple-negative or HER2 positive cancers, which require other treatments. 96. Oncologic emergencies require immediate nursing intervention. True or false? Answer: true. Rationale: oncologic emergencies like neutropenic fever, spinal cord compression, or hypercalcemia require prompt nursing assessment and intervention to prevent life-threatening complications. 97. Testicular self-exams are recommended for men starting at age 50. True or false? Answer: false. Rationale: testicular self-exams are recommended starting at age 15 to 18, as testicular cancer is most common in younger men, ages 15 to 35, with early detection improving outcomes. 98. Cachexia in cancer patients can be fully reversed with nutritional supplements. True or false? Answer: false. Rationale: cachexia involves complex metabolic changes driven by tumor-induced inflammation, not just nutritional deficiency, making it difficult to fully reverse with supplements alone. 99. Antiemetics are only used after chemotherapy-induced nausea occurs. True or false? Answer: false. Rationale: antiemetics are used prophylactically before chemotherapy and as needed afterward to prevent and manage nausea, especially with highly emetogenic regimens. 100. End-of-life care in oncology includes support for family members. True or false? Answer: true. Rationale: end-of-life care in oncology involves holistic support, including emotional and practical assistance for family members to address grief, caregiving needs, and bereavement. 101. Breast cancer can metastasize to the lungs. True or false? Answer: true. Rationale: breast cancer commonly metastasizes to the lungs, bones, liver, and brain, leading to symptoms like shortness of breath or cough, requiring imaging and systemic therapies for management. 102. Chemotherapy is always administered intravenously. True or false? Answer: false. Rationale: chemotherapy can be administered intravenously, orally, e.g., capecitabine, topically, or via other routes, depending on the drug and cancer type, offering flexibility in treatment delivery. 103. Alcohol consumption is a risk factor for oral cancer. True or false? Answer: true. Rationale: chronic alcohol consumption irritates oral mucosa and acts synergistically with tobacco, increasing the risk of oral cancer by promoting cellular damage and carcinogenesis. 104. Mammograms can detect all types of breast cancer. True or false? Answer: false. Rationale: mammograms are effective for detecting many breast cancers, but may miss some, like lobular carcinoma or cancers in dense breasts, requiring additional imaging like MRI or ultrasound. 105. Elevated alpha-fetoprotein (AFP) levels are associated with liver cancer. True or false? Answer: true. Rationale: elevated AFP levels are a tumor marker for hepatocellular carcinoma, often used to monitor disease progression or recurrence, though not specific enough for diagnosis alone. 106. Radiation therapy can cause fatigue as a side effect. True or false? Answer: true. Rationale: radiation therapy induces cellular damage and inflammation, leading to fatigue, a common side effect, which can be managed with rest, exercise, and energy conservation strategies. 107. Tumor lysis syndrome is treated with diuretics and hydration. True or false? Answer: true. Rationale: tumor lysis syndrome is managed with aggressive hydration and diuretics to promote renal excretion of electrolytes, along with medications like allopurinol to reduce uric acid levels. 108. Neutropenic fever is only caused by bacterial infections. True or false? Answer: false. Rationale: neutropenic fever can be caused by bacterial, fungal, or viral infections due to low neutrophil counts, requiring broad-spectrum antibiotics and diagnostic workup to identify the source. 109. Hair regrowth after chemotherapy is always the same color and texture. True or false? Answer: false. Rationale: hair regrowth after chemotherapy may differ in color, texture, or thickness due to changes in hair follicle function, though these changes are often temporary. 110. Palliative care is only for patients with advanced stage cancer. True or false? Answer: false. Rationale: palliative care can benefit patients at any cancer stage, addressing symptoms, stress, and quality of life, and is not limited to those with advanced or terminal disease. 111. Acute myeloid leukemia is more common in children than adults. True or false? Answer: false. Rationale: acute myeloid leukemia, AML, is more common in adults, particularly older adults, while acute lymphoblastic leukemia, ALL, is more prevalent in children. 112. Regular exercise can reduce the risk of breast cancer. True or false? Answer: true. Rationale: regular exercise reduces breast cancer risk by lowering estrogen levels, improving immune function, and maintaining healthy body weight, particularly in postmenopausal women. 113. PSA testing is used to diagnose testicular cancer. True or false? Answer: false. Rationale: PSA testing screens for prostate cancer, not testicular cancer, which is diagnosed with ultrasound, tumor markers, e.g., beta-HCG, AFP, and biopsy. 114. A fine needle aspiration biopsy can diagnose thyroid cancer. True or false? Answer: true. Rationale: fine needle aspiration biopsy is a minimally invasive procedure used to diagnose thyroid cancer by analyzing cells from a thyroid nodule for malignancy. 115. Immunotherapy is effective for all types of cancer. True or false? Answer: false. Rationale: immunotherapy is effective for specific cancers, e.g., melanoma, lung cancer, with certain molecular profiles, but not all cancers respond due to varying tumor immunogenicity. 116. Spinal cord compression can cause permanent paralysis if untreated. True or false? Answer: true. Rationale: untreated spinal cord compression from tumor growth can lead to irreversible nerve damage, causing permanent paralysis, necessitating urgent corticosteroids and radiation or surgery. 117. Chemotherapy can cause oral mucositis as a side effect. True or false? Answer: true. Rationale: chemotherapy damages rapidly dividing mucosal cells, causing oral mucositis, painful sores, requiring nursing interventions like saline rinses and pain management. 118. Cancer is always caused by a single genetic mutation. True or false? Answer: false. Rationale: cancer typically results from multiple genetic mutations accumulated over time, involving oncogenes, tumor suppressor genes, and DNA repair genes, triggered by various factors. 119. Avoiding red meat can reduce the risk of colorectal cancer. True or false? Answer: true. Rationale: high consumption of red and processed meats is linked to colorectal cancer due to carcinogenic compounds formed during cooking, so reducing intake lowers risk. 120. Fecal occult blood testing is used to screen for lung cancer. True or false? Answer: false. Rationale: fecal occult blood testing screens for colorectal cancer by detecting hidden blood in the stool, not lung cancer, which requires imaging like CT scans.